Hi, myself Dr. Nilesh Tatkare. I am MD pathologist at Clinico Diagnostic Center. Today I will brief about the diabetes and cholesterol levels. What are the risk factors which are because of which there are high chances of developing diabetes or high cholesterol? Long sitting hours, obesity, less physical activity, as well as it runs into the families also. Like those patients having their parents have high cholesterol or high diabetes, they can have the risk for these diseases. Why one should be very careful about the diabetes is because it can cause high risk of cardiac attack, heart attack, stroke, paralysis, kidney failures. The eyesight can reduce. There can be a food gangrenes. So one should be very careful about the diabetes. One should look for the symptoms, early signs for the diabetes, which are like fatigue, weakness, or excessive urination, loss of weight. If these symptoms are there, one should go for the test, blood test. Easy available blood tests are there, like fasting sugar, where there is only just 10 hours fasting required, and it's a very economical test. One should screen for this fasting sugar test. The value should be below 110. And then there is another postprandial sugar, where after the lunch or after the breakfast, 2 hours after that, one can go for the blood test. The level should be below 140 for the postprandial sugar. Then there is a very advisable test is there, that is glycated hemoglobin, which is usually recommended. What is the advantages of glycated hemoglobin is that it can tell you the control of last 3 months. The sugar, high sugar, will get bind to hemoglobin, and then that that is detected by this method. And so last 3 months sugar control, even though the fasting is not required, or even the previous day your meal might have a high sugar content, but this will not affect the level of glycated hemoglobin, HbA1c, that is. So it is recommended test. The level should be below 6, and if the for diabetics the level should be between 6 to 7. It suggests that there is a good control of diabetes is there. And then above 8, 9, 10, these are all the poor control of diabetes suggests. So that is the one of the best and advised recommended test for diabetes is HbA1c. Then cholesterol levels, these are again the risk factors are same as diabetes, long sitting hours, or the family history of high cholesterol. So, but additionally, the high oil content in the food, high oily food consumption can have a high cholesterol levels. Again, you are already aware that it will also increase the risk of cardiac or paralysis, stroke, all these diseases. The risk will increase. In cholesterol, one can go for the lipid profile test. In the lipid profile test, you will find various parameters. Like there is a good cholesterol, which is called as HDL cholesterol. The level should be more than 40 of HDL cholesterol. And then there is a bad cholesterol, which is LDL or triglyceride. These are the other two parameters you can see in the lipid profile. The LDL value should be less than 100, and the triglyceride level should be less than 150. And then these values, one should be regular monitoring. One should go for regular lipid profile test to look for this test. If you have a high cholesterol, there are medicines are available. There are statins and fibrates are available, and you can easily control. That is the good part for the cholesterol, that you can easily control it with the medicines. And but one should yearly, annually, regularly go for the follow up of lipid profile as well as HbA1c, fasting sugar, and postprandial sugar. Thank you.